All the predictions are that over the next 5 to 10 years there will be a massive rise in the proportion of people dying from hepatitis C. We've already started to see a small increase in the number of people with liver cancer, number of people with end-stage liver disease, and the number of people with hep C coming forward for liver transplants. All the mathematical modelling and all the predictions are that that will increase dramatically over the next 5 to 10 years. That will mean we will have fewer beds available in NHS hospitals, we'll have fewer livers for liver transplantation, we'll be spending massive amounts on drugs for liver cancer, and a huge number of patients will going to present to casualty with end-stage liver disease from hepatitis C. So I think the economic costs are going to be very considerable.
If you decide to screen the population in a country, as this was done in France, there is a major economical impact because you have to treat these people. And therapies are expensive. Obviously, you can achieve a cure, but you have to pay the price for this. And this has, obviously, in terms of public health, an economical impact.
There's a significant impact of hepatitis C. If you anticipate that 2% of the population, or up to 5 million people in the United States, have hepatitis C, they need certain aspects of medical care, and the annual costs associated, direct costs associated with hepatitis C can be between, per patient, can be between $10,000 and $20,000 a year with hepatitis C, obviously going up as their disease progresses. So economically it's an impact. Indirect costs, or costs associated with loss of days of work and et cetera, can actually be almost double the costs associated with the medical care.
At the moment, we're seeing a relatively small number of patients admitted to hospital with bad liver disease due to hepatitis C. The majority of patients that are admitted to hospital have alcohol-related liver disease. The problem is that we know the hepatitis C outbreak started about 30 years ago when we started to use very large amounts of blood, and there was a lot of dabbling with injecting drug use. Now, given that this virus takes 30 to 40 years to kill you, you can predict exactly what's going to happen over the next 10 years. Some of the most ghastly predictions are 3 to 5-fold increases in the number of people dying. There's a very real risk that we will simply run out of liver transplant organs. We simply won't have enough to deal with the number of people dying of hepatitis C. And the costs to the healthcare system of treating very large numbers of 50, 55-year-olds with liver cancer, with liver cirrhosis, will be absolutely colossal.